welcome to Torbay Hospital, the Digital Horizons Lab at Torbay Hospital. My name is Dr. Matt Halkes. I'm the Clinical Director of Innovation and Digital Transformation, and my colleague here with me is Nick Perez, who's our Head of Digital Technologies. And we're just going to talk a bit about our journey through innovation with immersive technologies. But the way we thought we'd set the scene is to actually play a short video that describes the achievements of Nick and his team, and then we'll discuss the innovation aspects that come out of that afterwards. So we'll play the video and then come back.
Immersive technologies for us have already had a significant impact, and it's still such an early journey in that. We think about using this technology for rehab, for using it in pain and anxiety distraction during operations, or even with our staff groups for improving education, or more importantly, their well-being. Removing somebody from the busy clinical space for a short time into one that evokes relaxation and calmness can be very powerful. Whether it's recreating difficult to train in environments, or even this year with the pandemic, upskilling staff but still making sure we retain the importance of the human in the journey, seeing different perspectives and recreating scenes of the past that brings a deep sense of connectivity and joy, particularly for those that may be feeling isolated. And when you look at healthcare like that, it goes far beyond walls, which is what it should do.
My name is Nick Perez. I'm the lead for learning technologies here at Torbay Hospital. And over the last few years, have had a remit and a heavy interest in the development of virtual reality interventions in the healthcare space.
And I consider it our role at Torbay to help inform the conversation around the value of this technology, both with staff and patients. And we do this through co-design, collaboration and partnerships, and run a number of projects.
So let's start with patient VR. And this is a project we set up a few years ago to understand the importance and the significance that non-technical skills have on the patient journey and for our performance as clinicians and healthcare staff. Things like eye contact, empathetic gesture, effective communication. So this idea of embodiment, of seeing these environments from the patient perspective, allowing us to understand the things that we sometimes miss and take for granted, the small things that can make big differences.
And we expand on this interest and need to reflect on the humanities and empathy for utilising the powerful narrative-driven and body labs experiences, placing our staff and trainees in the perspectives of those whom we care for. This really was quite a simple project to create and set up, filming from the patient perspective, 360 videos, and then allowing our staff to look around and virtually put themselves in the shoes of the patient, and starting with very accessible technology. So the lowest fidelity of virtual reality, allowing our workforce to get used to this interactive modality in the classroom. And 360 video now being used in so many different ways, from training procedures to understanding difficult environments and breaking those down. And where appropriate, actually training our clinicians to be content creators and having that creative ownership of the training scenarios they make.
We also have a VR lab here embedded at Torbay Hospital. It's sponsored by Health Education England and allows us to look at some of the new technologies, the hardware and the software involved in the virtual reality space.
The lab also offers us a platform and space to co-design some use cases and custom experiences. For example, we've been creating virtual community and home-based settings where those environments play such a big factor in understanding the patient's backstory. We've also been looking at team and workforce-based activities such as critical communication and teamworking skills, utilising gamification.
There's one that's a stick with like a basket hanging on it, a side basket.
In this example that utilises a popular VR video game, a team must defuse a bomb within 5 minutes. We debrief each scenario to understand the critical communication that's occurred, and we've been running this for 2 years now, and it's been a really effective way to bring teams together. There are other obvious educational uses of this technology, such as bringing things to life from the textbook. In this example, virtual anatomy.
Just blown away by the whole experience, really. Very often we're talking about cases with the consultants, and we're talking about them, but having the facility to walk around the anatomy and actually pinpoint where we're planning on operating, structures to be avoiding, things to be careful of, would just be next level, really.
And these experiences and technologies have become more featured in our open days and our outreach with schools and colleges and universities as we start to consider what future careers in healthcare might look and feel like. Virtual wellbeing has become one of the most important areas of our work, finding suitable interventions to support the well-being of our staff groups and of course our patients too.
You are about to follow a 10-minute guided meditation. By following my voice, you will be guided on a journey that will help lead you to a state of deep relaxation, where you can change the effect fatigue has been having on you and learn ways to relieve the unpleasant symptoms.
And yes, that is David Attenborough. We worked with academic partners at Birmingham University and Bob Stone to create a relaxation scene for staff, which has been particularly useful and well utilised during this year's pandemic.
Start by breathing in gently and out slowly, and continue to do this as I guide you.
Bringing the therapeutic benefits of the outside and nature into the clinical spaces has been really beneficial to us. We've used nature scenes like this to look at pain distraction and anxiety reduction for our patients as well as our staff. We work very carefully to make sure these are appropriately used, and when they do, they sometimes create a bit of magic.
Nick on intensive care was absolutely awesome. Bearing in mind he is in intensive care, so we can't forget why he's there, but his engagement and his activity and the miles he covered with his SAT still being 98% at the end was absolutely stupendous.
Oh, that is magic, isn't it, eh? Oh.
It's a little bit emotional because it's like something he built for a PhD that was just designed to be used in one sort of environment has suddenly been put into a new one, and to see it going flawlessly with no issues and all the issues that we have had in the QE not happening here, it's kind of, it's a kind of strange feeling. You feel a bit like, elation. So yeah, I'm pretty happy.
There's this growing crossover, this applicability from what we've learned in healthcare into social impact, into our communities, tourism, heritage, whether it's recreating a scene from history for somebody, or whether it's showing a location as it once looked. It's all really about trying to make a positive difference for somebody, an impact. And it's really exciting that a technology, when it's considered and used in the right way, can bring all those things together. So we bring the influences and the benefits of the outside in, and in return we take our knowledge and the things that we've learned out. And it creates this wonderful opportunity to continually engage, to understand different perspectives, to understand the multidisciplinary approach that has to be taken with any new technology, really. And more than anything else, it tells us that healthcare belongs to everybody, and we all have an investment within it. We all have a story to tell. And the most important thing is that we make sure those stories are heard. And the technology, well, it's just another way to enable that. Sharing, collaboration, and human-focused, human-centered design is always going to be key.
Great. Well, Nick, that video is 7 minutes long. But
Sorry, I'm trying to cut it down.
No, but it summarises a 5-year journey that you've been on here in the Trust with the team. And what was here when you first started? What was here in terms of immersive technologies, and what got you started on that journey?
The word immersive, if we talk about immersive, you talk about VR, you talk about visual interfaces and such like that. And I don't think we had an awful lot here, really. This whole idea started with something which wasn't about immersive. It was about something quite fundamentally important, but quite simple. And that for me was capturing, as you saw in there, a different perspective, the patient perspective. What we had been doing really well, like many hospitals, is we've been looking at technical skills training. And as part of that, you have the simulation program, whatever else. But my background, as you know, is filmmaking. And a filmmaker coming into the healthcare environment, you look at imagery in a different way and what we can learn from imagery. Really simple idea was capturing the patient perspective, the patient journey, what these environments we work in look like, from a patient perspective, communication, those sorts of things. So really, it wasn't a tech kind of start, if you like, but it was very much a humanistic kind of need. The VR came later because what we wanted to do was not just capture the patient perspective, as is, and that kind of view, but actually capture everything around it. And that would mean looking at 360 video, interactive 360. And VR became a platform for delivering that quite effectively.
Yeah.
So actually putting clinicians in the shoes of the patient, allowing them to explore those environments and look for things within that space. It really enhanced the learning, because what we had was we had groups of people all looking at the same experience, but looking around 360 and noticing things that maybe the other person next to them didn't. What we do really well in healthcare is we debrief, don't we, in our education. We talk about what we've witnessed, what we've taken part in. I think having a debrief on the back end of that really enhanced a lot of the learning. So that's how it began, something actually quite simple, but using VR for enhancing that.
And you're saying our focus was very much technical skills, but our problem was empathy and compassion on the ward. So I think that's why the Trust adopted this and wanted to explore it further. But I mean, we work in a big organisation, quite a cumbersome organisation. NHS, perhaps not renowned for rapid adoption. It is innovative, but it's not rapid adoption. So how did you start getting the support you needed to...
To be honest, I think I was a bit of a rebel. So the first thing I did was try and get hold of some sort of VR hardware. And that meant investing my own money to start with, but also reaching out to suppliers. At that point, VR was on its very, very early stages of this reiteration. And so there was a lot of development kit out there. And I remember very kind of naively emailing a company called Oculus, who are responsible for a lot of the VR hardware now, and saying, look, I've got this idea. I think it's going to help us understand some things in medical education a little bit better. What do you think? And they responded with, well, we'll send you a couple of headsets down. And I thought, well, that's the fantastic win. If you don't ask, you don't get. But also, you were director of education at the time, and I remember sort of coming to you, knocking on your door, going, I've got this idea. I want to create a proof of concept. It's going to look like this, and I think it's going to feel like this. What do you think? And you took a punt and said, well, let's give this a go.
But I think the reason we could explore it further is because you were aligned to the strategic needs of healthcare and the Trust as an organisation. So the problems you were trying to solve, as I say, the problems that the organisation had. So we were well aligned.
Yeah.
But any other barriers that you met along the way?
Well, when you're dealing with something like the NHS, there are lots of barriers. Some of them are smaller. Some of them are because of the process and the systems in place. And that the most silliest barriers, I suppose, are our procurement system. So trying to explain why a 360 camera or VR headset is important to procurement when they've never experienced a product like that can be difficult. You have IT infrastructure, which doesn't necessarily like communication with devices outside the IT network. So you have that to deal with as well. You have a whole ethical side of it as well. We're asking people to process a medium in a different way. You know, VR is very, very powerful. And because of that, we have to make sure we facilitate it correctly. You know, putting somebody into a scenario where you see the patient perspective during a very tricky pathway is going to also evoke some emotional reaction, you know. And so I spent a long time really trying to work out how one facilitates this, that makes sure there's still those safe points in the system where if somebody finds this uncomfortable, if somebody has an issue with that, they're able to come out of it, or they feel like they can leave the environment without being unaffected. I think that was the biggest thing for me. But trying to do education a bit differently, at first, it was quite tricky, you know. And I think that's changed over the last few years. What you're seeing now is you're seeing emerging technologies like VR and AR have an accepted place in simulated training. So it's a different story now than it was 5 years ago. But yeah.
So as you know, we put the video out to some of our innovation colleagues and got them to submit some questions in advance. And one of the common themes was, how have you engaged patients in the co-design of the the end users as well, the educators and the clinicians? Yeah,
no, sure. And I think because we started talking about patient VR, but actually the VR program is quite expansive now. It covers a lot of different areas. The patient perspective work was actually driven from personal experience of being a patient suddenly. You know, working in healthcare and then being a patient in healthcare are two very different stories. And when I became a patient for a few days, I saw the same places I was working from a different perspective, and that's what drove that. And I thought at that point, engagement with the patient, with the relative, with everybody in the system is extremely important. So the VR lab, when we created that a few years later, it was an exploratory space, really. We felt there was lots and lots of potential with VR in different areas as well. But it wasn't about the technology. It was about the opportunity it gave us to meet together in a space and talk about what could something look like to solve a problem, an issue, something like that. That's where the value comes. The technology takes second place, but actually getting everybody around in a room for half a day, patient representative, clinicians, other staff as well, that's extremely powerful. And I think that idea of co-design is relatively not new, but it's something we don't use enough in healthcare, I would say. And I think that's what it's opened up, these doors of actually looking at the end user right from the early stages.
Tell us a little bit about users as creators, as content creators. How have you approached that?
Again, it seemed a bit crazy at first, having the idea that actually, what if clinicians became content creators? But I think it's about appreciation for, in this particular context, what imagery can teach us and do. And you get an appreciation typically from something like film if you understand some of the process that goes behind it, some of the reasoning why you pick a particular shot or you frame something in a certain way. And having clinicians and our staff take part in the production of their own video scenarios was both creatively a release for them. It's something a bit different, and they get and they enjoy and they engage with that. But they have a creative ownership, and that's really, really powerful and important. Again, somebody who is part of the process from the start to the finish will have an ownership of something, and they will become a champion of that. In healthcare, that's vital because we can create whatever we like here in this little safe area of education, but then getting it in use in the clinical space or where it's relevant, you need your champions. And to have your champions there, you have to bring them in on the journey. I think there's a lot we learn from something like film anyway, and video production and such like that. And I'll harp on about that. But actually having them from the start to the finish, they then run with it. And me as a digital technician doesn't have to be the driver, and I shouldn't be the driver of it. It should be run by those that understand it, that embrace it, and it's their speciality or their subject matter, so.
Have you met any resistance at any time from people not wanting to engage?
I think resistance to probably using VR as an example in a particular educational context, but I think that's to be expected. You're asking people to do something different and new. We have a digital literacy in healthcare which expands, and is so scalable versus other places. We have people who are very, very tech savvy that come in, and you have people who want to avoid technology in any form because why we're here is because of giving care to somebody. And I think technology in the past has been seen as a preventer of that at times. And so it's been really important to engage everybody as best we can by making it as accessible as possible. So one of the shots you may have seen in there was us using cardboard VR headsets, which is a bit of a frowned on thing, I suppose, by VR professionals, because it's like, well, that's not the best experience of VR. It's more important that we had engagement. And I think by giving somebody a low form of technology for them to explore, to use their own smartphone they're familiar with, to understand this is cardboard, it's the start of that technological journey for somebody. So it's really important to be able to look at.
You've lowered the barrier of entry to come in and experiment.
Yes, and I think there is value, and that's where I say there's value to all fidelity of technology. Like there's value to the low end as much as there is the high end. The focus with these technologies is always the high end, but actually we have to work with the target audience we have, and sometimes that means going low first to the low end.
So one of the other core questions that people wanted to get, how do you know you've been successful? How do you measure the value that you've delivered?
I mean, measurements been important to us throughout, really. And I suppose it started kind of very simply just engaging with our staff members, those that are taking part, and sort of finding out from them what it meant to them to have that moment of reflection from the patient perspective, for instance. And that was quite anecdotal to begin with, and we'd get quite a lot of feedback. And then what I started noticing was when people would email me months later and say, just wanted you to know, I picked up something from your film and I've been using it ever since. And it's the simplest of things, and you're making a difference, because someone will say, well, actually, when I'm talking to a patient now, I will use a particular set of words, or I'll approach the bed space in a certain way. So you get that kind of feedback. But then we've kind of built a bit of a VR, a research base around the VR work now. We have a couple of people in post who it's their role to do the research around this, to do service quality evaluation as well. We have quite a lot of research in terms of questionnaires, focus groups, and those sorts of things. It's an ongoing process, but everything we create, or everything we put out there, we make sure we get studies around that. You have to really be very, very particular, I think, to make sure that there is value to this, because we're, you know, doing something new. We have to make sure this is valuable versus what we were doing beforehand. Otherwise, it becomes a gimmick, it becomes that novelty. And I'm always worried that a new technology can be a novelty until you can prove otherwise. So,
you touched on you have to be called. You know, I've seen the impact putting somebody in an immersive environment, particularly when they're seeing a patient's perspective.
Yeah.
From doctors, nurses, and even our executives have had that sort of emotional response.
Yeah.
So I can fully appreciate that's one thing you have to be aware of and have to plan for. But have you come across any other unintended consequences of using VR or immersive in these scenarios?
I suppose I'm always amazed at what it evokes for our healthcare staff. So a lot of the focus with VR, I think, in other places has been, and rightly so, has been the patient journey, the patient comfort. Yeah, so we can use VR for pain distraction, anxiety reduction, those sorts of things. You see with examples of that. But I'm always blown away by the effect it has on our staff as well. From a well-being perspective, having a nurse go into VR and say, you know what, that's what I needed today. I'm absolutely knackered. I'm tired. And I just needed permission to have that 10-minute break. And that's what that did for me. That's really powerful again. It's not saying VR is going to change your life, but it's allowing somebody to reconnect with something, or just to have permission to have that time out, or just some sort of connection there. And that's, to me, the best bit about this, you know. So the amount of times you have something that comes out of a headset or an experience and just goes, you know, at that point, you've done something right. So, yeah. So
obviously the journey has been around immersive technologies, but if you were to repeat that journey with another technology, do you think what would you do differently? How would you approach it, both from the technology and in the healthcare context?
Yeah.
What would be the key things that somebody should bear in mind?
Yeah, I think you could definitely map this journey to other technologies, and I think that's something we're doing now. I would like to engage that co-design right from the start of the technology. Okay. So, you know, although we talked earlier on about bringing VR in because we've had a hunch, I think actually you can have a more directed entry route for any technology now by having that co-design, by bringing a group together on that level playing field. You know, to me, that's the first place I would start, would be bring people together and talk about, look, this is something we've got. Is this going to be of value, and whereabouts could it possibly have value? You know, that engagement is so important. And I keep trying to get away from the fact that I'm somebody that works in digital technologies. I almost want digital removed from the name because for me, it's about the connectivity with everybody, and you can almost remove digital from it. It's just that we have some tools which happen to be digital, and some trends which happen to have a lot of potential. But really, fundamentally, it's about connectivity and understanding from each other what is important, and saying that these are the tools that we could possibly use.
So going to the other end of the innovation journey and the spread and adoption, what uptake is any success regionally, nationally with picking this up?
Yeah, and yes, I'll be absolutely candid here. And I don't know if it's the same experience for other people working in innovation, and tell me if it is, but so essentially what we did was we created something, and soon after you become a perceived expert in something. And I don't like the word expert, because I think when you're exploring something still, it doesn't feel like you are an expert, you know. And there's something about creating, exploring something, finding value in it, finding success in it, and then suddenly talking about that technology to others, you know. And so one of the things that we do here now is we help inform national strategy around immersive technologies and the uptake of it. And one of the things that I tend to do almost on a weekly basis is talk to other trusts about their start of their journey using immersive technologies. But it's only from our own experiences that I have any indication of where the successes lie. So I'm always drawing on our own journey. And to be honest with you, parts of that journey felt like we were kind of finding our feet, you know, finding our way through it. There wasn't anything to draw on for that. So I suppose for me, it's, it's just relying on our own experiences and trying to inform the conversation through sensibilities of our own learning. But yeah.
Towards the end of the video, you mentioned about taking this out into other settings in the community. So just tell us a little bit about your thinking around that. And just if anyone's got any questions, please do put them in the chat. We'll try and pick up on them.
So one of the kind of obvious things we've been involved in is outreach, firstly. So what we do realize is that healthcare careers of the future, some of those are going to look very different from what we currently have. Some of those are going to have elements of digital actually sewn within them from the very start. And some of those are going to be really harnessing digital skills, which we don't currently do. And so one of the things that we do as an immersive team is we go out and we talk to schools and say, look, this is what the future of healthcare could actually look like. And look how engaging it is. Look at how we are educating around the anatomy, for instance. Look at the way we are looking at staff well-being. Look at the way that we can empower the digital citizen. And I think you have that very obvious outreach. But when you look at the technology itself and you realize some of the stuff that you create is actually goes far beyond the walls of the hospital. So when you talk about well-being, when you talk about creating an environment which has a connection with somebody, that's about somebody's journey. That doesn't have to be in the acute setting, if you see what I mean. Yeah. That can be taken out. But of course, in the process of that, you have things like tourism and heritage and such like that, where you create worlds, you create things that how they looked before and you bring them back to life. And that has obviously relevance in healthcare because you can take people into places or back to places which have been important to them in their history. But actually on the other side of it, imagine, visiting Torbay in the 18th century, and that's quite interesting. So I think there is a lot of parallel and overlap there. So, yeah.
Right. We've got a couple more minutes to see if there's anything in the chat. Not currently. Has anybody got any questions? If not, we'll carry on. So, taking it into other sectors, do you think that's something we should do as a healthcare organisation, or do you think that's something they need to learn to do for themselves? How do you get that transference? What would be the best mechanism?
I think we've got an awful lot of learning we can share, which is applicable whatever sector you take it into. So our learning is, how do we make this comfortable and of value? How do we facilitate its adoption with a wide digital literacy? And we have some of the sensibilities around the type of content that's shown, where effect and value can be found. And I think that's the stuff that is of value to other people. I think too much of the time, this sort of tech is marketed from the market objective of, this is a bit of tech that's going to do this and revolutionize this and this. But there is this whole thing about the audience who engages with it, and it's very easy to drop money on a product for Christmas, but then to let it kind of sit on the side and gather dust. And we found that in healthcare, where we've invested in the technology and it just gathered dust there. So I think a lot of learning we've done here is on the way people interact with it, the type of content that matters. And I think that's two of the key messages actually for virtual reality. So
fun. Okay. Great. Well, I think how can organisations identify and support champions? Yeah, I think the champions is a really good point, because we know that when we need something done in the trust, we head up the hill and find our champion.
Yeah.
So how do we find those champions? How did you find your champions?
I think so. I think the champions are already there. I think a lot of this stuff is based on passion, right. and interest. And what we tend to find in healthcare, at least, is you have the doctor who spends the weekend learning software development, or the nurse who on the side has been working on this idea around mental health, and it's already there, but we have to allow the safe space to let them explore that and support it. That's the difficulty we have, is that people come to work 9 till 5 or longer in healthcare. They go home, that's all we expect, and that's it. We've got to be able to support innovation and understand that innovation can be for everybody. It's not an elite thing. It's not just for the consultant that's been here for years and years. The porter can instruct change as much as anybody else can, So
excellent. Well, I think on that important message, we'll say thank you very much, Nick, and thanks to the team for facilitating the studio.